I'm a nurse at Towner County Medical Center, and I'm an RN. I have a bachelor's in science in nursing. I just want to go a little bit into the different types of nursing. I have a 4-year degree. There's also an RN that is an associate's degree that is a 2-year degree. And then there's also LPNs that go to school for approximately 2 years for nursing. I actually went into nursing. I always thought I wanted to be a broadcaster right away when I was younger. My aunt was a nurse, my mom was a nurse. I saw how much they really enjoyed and loved their job. I always wanted to help people, so I did go into nursing and I realized it was a good fit. You can help people with all the different skills you learn. You make such a big difference in their lives, and I don't think anybody who's not a nurse or a doctor really understands how much you're there emotionally and physically for the patient. And I'm going to show you the skill of how to put in an IV. So first and foremost, anytime before you do a skill, you want to wash your hands. It's usually with some sort of antibacterial wash. And then you always want to protect yourself and the patient, so you always want to make sure you put gloves on. All right, so now you want to make sure that you put a tourniquet on the arm. There's a little bit of an art in tying this to make sure to get it tight enough and also get a knot in. All right, now that the tourniquet's on, we want to find a good vein here. These are actually really easy to see veins. They're all pretty blue. Sometimes you have to palpate to see the vein or to feel the veins. It can be challenging, but this is not going to be as challenging as real life. So once you find the vein that you want to use, you go ahead and clean it well with an alcohol swab. And today we're using the smallest gauge needle that there is. However, the ones that we usually use are quite a bit larger than this. We're just using a smaller gauge so we don't hurt the skin of this fake arm. So in order, let me just get it where I want it. So you go ahead and there's a little, it's called a bevel. One side is sharper than the other. That bevel needs to be down, that sharper part needs to be closest to the skin. So go ahead and hold the arm still. Visualize the vein. My bevel down and go straight in. All right, so if you're in the vein, you should start getting blood return, which is here. It's kind of our pink colored water today, and you see that filling up. So I work in the ER. So a lot of times in order to cause the patient less pokes, I get blood work for lab at the same time. Let's see, make sure this isn't turned up all the way, otherwise it'll get kind of messy. So what I do right away when I get the IV in, I go ahead and try to slide the needle out. It's gonna be hard kind of to show you. Slide the needle out and put this lure lock right on and take some blood out for lab. So hopefully it saves the patient a poke. So I slide the hub in as I pull the needle out. And I keep the tourniquet on. That helps keep the blood flowing in order to get enough blood for lab. And there you go. Lab will usually tell you approximately how much blood they need for the test that the provider ordered. And we'll say that's good enough. So at this time, you want to make sure you have things set up. Right here, this is a lure lock for the end of an IV. As one side, it kind of seals off the vein so no bacteria or air get back into your vein. So I'm going to undo this, hook that up. I'm going to undo my tourniquet, and then I can flush into the vein. That makes sure that you are in the vein. Make sure it doesn't cause the patient much pain and that it's not getting puffy, then you're not in the vein anymore. But I think we're good here. I'll go ahead and take this off. Now this won't leak anymore because it's kind of a little bit of a seal. Take that off. Now it's time to tape it. You take a piece of tape, slide it under, and kind of just crisscross it over the IV. That gives you a good seal there. We also use a little Tegaderm. That helps to decrease the amount of bacteria that can get into the skin from that opening in your skin. And you want to seal it right around there. It also helps to keep the IV in place also. So now that we've gotten an IV placed and gotten blood for lab, the next thing they would like us to do is to give them some saline. And this is something very common that we do. I have the tubing and the saline bag already here. Someone already was nice and primed my tubing. Priming the tubing means you insert it into the bag and you got all the air out. So it's completely full of the saline. Now again, we want to keep the patient as safe as possible and everything as clean as possible. So I'm going to go ahead and use an alcohol swab and swab the end of this lower lock to prevent any bacteria transmission. And this has been sealed and stayed sealed the whole time. It should be sterile. I'm going to take it off. And go ahead and you push it. It pushes a little hard because it's breaking that seal. And then you twist it on. And then when it's on there, I can go ahead and open it up. And then you should start to see it dripping in the chamber. And that means the patient's getting hydrated and the IV's good and everything's working. I can also go ahead and tape it down. Nothing's worse than an IV you put in an IV that was hard and then all of a sudden it gets pulled out. So more than likely you'll have a lot of tape with your IVs, but it's just because we want to make sure it stays. Always make sure you get your sharps in the sharp container. All right, so now this patient needed a little hydration in the ER. They're feeling a lot better and the provider gave you discharge instructions to send them home. So at this point, I need to go ahead and clamp my saline. That's stopping the flow. I can go ahead and untape my tubing. I can go ahead and untwist and take my tubing off. At this point, if I'm not going to use it again, it's fine if I get it dirty. Otherwise, there's other caps you can put on to keep it as clean and sterile as possible. Now I need to undo my Tegaderm that I placed. And undo my tape. And you take a gauze pad, fold it into fours here. Place some pressure right where that little plastic tube of the IV you're going to pull out. And put some pressure there because your body will want to bleed a little bit. And you want to place pressure there for a good 30 seconds or so, depending on what kind of medication the patient's on for blood thinners. I'm going to go ahead and put a piece of tape on here now. There, the patient should be good.